All right, now welcome to the advanced core progression where you should have your issued handy dandy ball. If you don't have one, please go down to the store and purchase them. You can get them as cheap as $15 some places. However, I would say spend a little more just to make sure one won't pop on you. What we want to show you right now is how to really size a ball correctly for your use. If you look at Teresa, she has the optimal alignment for ball placement. Her knee is bent at 90 degrees and her hip is bent at 90 degrees. Even slightly above is okay. Anywhere below that is not okay, because that ends up pinching your hips and creating a little bit more of a pill bug type of position, and that's more of a strain on your back. What's also good is once you get on your ball and you play with it, bounce a little bit. It starts to ignite your core a little bit, and it gets you also very comfortable with the idea of being unbalanced. The key to putting someone on a ball is really to put your spine in a position where the core must ignite to keep you from falling off of it. That's the purpose for ball exercises. It's not meant to just be something gimmicky. It's really meant to fire up your core, because your core only works best when it's challenged outside its normal balance alignments. So from here, we're going to move right into our first exercise, which is called the marches and rotations. So she's going to turn to face you so it's easier to see this. First, you always want to maintain excellent posture. Don't round your back. Don't slump your shoulders. Make sure your chest is up and out. Your abdomen is relatively tight or contracted, and your feet are firmly on the floor. You can vary your width depending on how much comfort you have sitting on the ball, but ideally, the more narrow you come, the more your core gets challenged. Now for Teresa, I'm going to hand her a medicine ball. It weighs about 2 or 3 pounds. What you can use in this case is actually an empty milk jug filled with water. Empty out the milk, or please drink it, fill it with water, and have it about 2/3 full. The sloshing and movement of the water is going to challenge your core even more. But in this case, we have a medicine ball. Teresa's going to grasp this and hold it out directly in front of her, again with great posture. And as she is going to make this movement, which is moving her arm up and down with the ball, she is going to bring a leg with that movement. Up and down, this leg goes, and then the other leg. Notice, as she is doing this, she has to shift her center of weight in order to maintain her alignment on the ball. This can be very difficult. If with the weighted ball you have a hard time doing this, or any kind of weight, you can do it without any weight, just to get used to this control and balance. Having a wall near you is also good for your own safety, because being on a ball and not having good balance is something that's going to challenge you somewhat. So be smart about it. Have something that you can hold on to in case you lose your balance. The idea here is that this is where the work is coming. You're not going to get a lot of fatigue or pain in this one. Your arms are going to get tired first, and that's just fine. I ask for 20 total movements of this exercise, which means every time that arm goes up, that's 1. But you're alternating, so each leg will get lifted about 10 times. Once again, going back to the glass, if I have it on her head, it shouldn't spill. After she completes that 20, I'm going to challenge her outside this plane and get her to rotate in the opposite direction of the leg lift. So she will rotate her upper torso to the right while her left leg elevates, and then she'll come toward me with her right leg elevating. She'll go back and forth this way 20 times. Again, trying to maintain stability. Some people will get out into one phase and they'll have a hard time maintaining that control. If that happens, you want to hold it as long as you can to try to get that control back. This exercise is all about center control. It has nothing to do with your arms and legs. I want you to be balanced. I want you to be stable. That's what we're looking for. Teresa's showing you the best positioning you could get. But don't be surprised if you feel quite wobbly at first. 20 and 20, and that's all there is to it.